Hello everyone, welcome back to my YouTube channel Midcode Education. This is the video related to our mock question paper part 2. So let's get started. 21st question. The term intra-service time has been measured in studies and is predictive of the work associated to E&M service. Intra-service times are defined to face-to-face time for office and other outpatient visit and as unit flow time for hospital and other inpatient visit. What is included in the intra-service time for an office and other outpatient visit? Panel test in pathology and laboratory section of CPT book include all the code listed with the panel description. When a panel is performed and additional pathology or laboratory tests are completed, how should those additional tests be reported? Here are the options. Check all the options and take the appropriate code or answer. Okay. Just mention in the comment box or in your notebook. Okay. 23. True or false related. Moderate conscious sedation is included or bundled in code listed in Appendix G. The statement is true or false. Next section is HIPAA related. 24. A critical ill patient transferred to the super specialty hospital from emergency department of the rural hospital and the ambulatory assistance provided for the patient which HIPAA plan cover this entirety. It is related to which part? Here are the options. Option A part A, option B part B, option C part C and option D part D. 25th question. It is also same as like of true or false related. One of the example of ABN is if the doctor or supplier does not give you an ABN then you sign before you get the service and Medicare does not pay for it, then you will have to pay your doctor or supplier for it. The statement is true or either false. 26. What are the eligibility of Medicare system? Option A, people who are older than 65 age and ESRD patients. Option B, low income people. Option C, newborn. Option D, pregnant ladies. Next is the integumentary system section 10K series. Okay. 27. A patient present for an incision and drainage of a pilodial cyst. What is the correct code for this services? Option A 10060, 10061, 10080, 10081. 28 question. Heather present for a removal of 3 benign sebaceous cysts. The first lesion excised from her leg is 3 cm. Which require a 4 cm incision. Okay. The second lesion excised from her abdomen is 5 cm which required 5.5 incision. The third lesion excised from the scalp is 0.5 cm which required a 1 cm incision. The physician performed intermediate layered closure to the wound on her abdomen. The other wounds were repaired by simple closure. What are the correct code for this services? Just pause the video and try to answer all the questions. Okay. 29. A splinter is removed from the subcutaneous tissue of patient's index finger through an incision made by the physician. The medical records state that this was a complicated procedure. How should the physician code this procedure? Thirteenth one. On January 31st, Barbara had a 2 cm malignant lesion excised from her left foot. During a post-operative checkup on February 2nd, residual tumor was noted in the margin of the original excision and the margin were re-excised. The re-excision is included 3 cm excised diameter. How would the same physician code the re-excision? Thirty-first question. Dr. Smith completed an extensive debridement due to infected skin. The patient was an 18-year-old who was fully cooperative. The debridement included 30% of the total body surface including portions of his abdominal wall. How would you code Dr. Smith's services? 32. I think it's a long question. Dr. Fay, a dermatologist specializing in Mohs, completed surgery on Howard Wright thigh for an ill-defined skin cancer. Dr. Fay is acting as both the surgeon and pathologist for this surgery. The surgery consisted of 9 excised specimens prepared and examined during stage 1. Additionally, a total of 7 excised specimens were prepared and examined during stage 2. How would you quote Dr. Fay's services? In every 10K series, Mohs surgery is very important. Also repeated questions. So you have to understand the concept of Mohs surgery. Okay, it's very, very important. Please mark it. Okay. Next is musculoskeletal system 20K series. A surgeon performed a radical resection of both a malignant tumor from the soft tissue of the scalp and a malignant tumor of the mandible. A bone graft was completed during the same surgical session to the mandible. How would the surgeon code this procedure? (34) During a postpartum checkup, Kyla told Dr. Terry her OBGYN about a recurrent lump on her right wrist. Kyla has a history of ganglion cyst on both wrists. Dr. Terry refers Kyla to Dr. Eakin, a general surgeon who excises the cyst. How would you quote Dr. Eakin's services? Just code only for Dr. Eakin's services only. Okay. Read the question carefully and answer all the questions. Okay. 35. A patient has been diagnosed with Treacher-Collison syndrome. A surgeon performs Lefort to reconstruct the midface by anterior intrusion. How would you code for the surgeon's services? 36. Judy noticed swelling in both her lips. She is referred to Dr. Royce, an orthopedic surgeon who performs a fasciotomy on both hips. Prior to surgery, Dr. Roy obtained the patient permission to have a resident observe the surgery. What is the correct code for Dr. Roy's services? 37. Zajari injured his back while playing tennis. His injury required surgery. He was taken to the operating room where an orthopedic surgeon performed an anterior osteotomy, including discectomy of 3 thoracic vertebral segments. Additionally, surgery required a structural bone graft obtained from a cadaver. How would you code this procedure? 38. A patient noticed a mass on his neck. He was referred to the general surgeon who determined that the mass was a 5 cm soft tissue lipoma. The surgeon took the patient to the operating room and removed the lipoma. The surgeon dictated in the operative report. This procedure was deep. How would you code the surgeon's services? Okay guys, this is enough for today. Next video I will upload more questions, 30K series, 40K series, 50K, etc. Okay, and also in the next video I will upload the answers also. Okay, more question paper answers. Okay guys, see you soon. Bye.